Rita?
Well, I'm over here, Tom. Hold on. I got to take a selfie real quick. I'm taking a little selfie with the doc over here because they are so common. The word is even in the dictionary now, and people are using more of that Photoshop, you know, to improve their pics, the little edit and all that kind of good stuff. Here to show us how, though, to get that picture-perfect selfie, please welcome dermatologist Dr. Sherry Ingraham. And then you brought in a lovely patient with you.
Yes, this is Brooke. So we are going to talk a little bit about getting a poutier lip.
Okay.
In a selfie.
Got it.
So I'm going to use a little Restylane Silk, which is a nice, soft, new filler. This is FDA approved for patients 21 years of age and older. And what we're going to do is we're just going to further enhance. She has gorgeous lips. So we're just going to add a little bit more pout to her lip here.
Now, Brooke has done this before, so she knows what to expect. So is it painful, Brooke? I know you can't talk, but how about you wave if it is or isn't?
No, not really at all. It's quick and easy, actually.
Yeah, she's had numbing on for about 30 minutes now, but you can see that just kind of raised her lip, gave it a little poutier look. We're going to do a little bit more of a pout in the lower lip as well. And I find lots of patients, especially patients in their 30s, even in their 20s, are coming in for these enhancements because they want to look a little bit more youthful or a little bit more enhanced in their selfies. We're also going to do a little bit of Botox. So I'm going to do a little bit in Brooke's crow's feet here. Smile real big for us.
And here's the problem with taking a selfie is when you have crow's feet. It makes you real subconscious because, you know, when you take that selfie, you can zoom in. And sometimes you'll zoom into the, you know, we are our own worst critic, right, Doc? So then you zoom into the forehead and the eye area and you say, I'm getting old.
Absolutely. And, you know, these high-def cameras we all have now on these newer phones are so unforgiving. And so even when you're in your 20s and 30s, things that you may have not noticed before when you take a selfie are just so blaringly obvious. So we like to do a little bit also in the glabella region because, you know, when you smile or frown or pout your lips a little bit, that may be more noticeable too. And another thing that we're seeing a lot of is patients coming in that are saying they have a more noticeable double chin. When they tilt their head to take a selfie, they're seeing that side profile or even their neck from an anterior profile. And so what's happening is we're doing a lot more of a treatment called Kybella, which is a fat-dissolving substance we do in men and women in the jawline. Men especially are coming in and saying, you know, in my selfie, I see this more now.
I mean, that's why you see people say, can you take the picture up, you know, get it
take it on high.
Right, take it high.
Take it high.
So the other thing that we want to mention also, you mentioned the double check. Yeah, she's bleeding a little bit. You doing okay?
Oh, yeah.
Yeah? So how do you see a difference when you take these selfies?
Absolutely, and I mean also being just preventative, you know, it really is helpful just instead of having to reverse it later on.
So Dr. Ingraham also talked to us about the fact that I want to look flawless, you know, the skin shiny, radiant almost in my selfies without having to hit any sort of edit buttons on the iPhone. So what can you help us?
People do not have time to airbrush their own photos. They want to post it to dating sites and go. So what I recommend are pore perfecting complexes. So MD Rejuvena has a pore perfector to make your pores look a little bit tighter. Look for products with retinol in them. There's some great over-the-counter products with retinol or a prescription retin-A. Also products with vitamin B niacinamide in them. So Metacell Renewal from SkinCeuticals is a great product that brightens you. Niacinamide helps to fade those brown spots and give you a brighter look, and it's great in patients in their 20s and 30s.
So if you're not able to get these particular products, something that you should look for over the counter are those two key ingredients that you mentioned. What are those?
Retinol and niacinamide. Those are great brightening products, and there's some great products by Olay and Neutrogena that contain both of those ingredients.
When will we start seeing sort of results? So if I went home and bought this cream, this over-the-counter with some retinol, when would I start seeing?
A few weeks. You know, it may be at least 2 weeks till you start to see some brightening. With her lips, it's an instant gratification.
They look
great. You can see she has an instant, beautiful, nice definition to her lips. Botox takes anywhere from 2 days to 2 weeks to kick in. So that's a little bit longer lead time, but not very long at all.
All right, Brooke, thank you so much for joining us and being, you know, the patient. Dr. Ingraham, thank you so much for that. That was great information. We're going to take a selfie. We got to take a quick break as well, right?